Thanks for joining us. We begin tonight with breaking news. Within the past few minutes, the House has passed the major health finance bill.
So let's get right to Chief Political Reporter John Croman, who has all the details tonight. John?
You know, that's the last of the big budget bills they needed to cover tonight in order to avoid a special session and a shutdown. Everything else they pass the rest of the night is going to be just gravy. It's going to be stuff they add on to that. But we're talking about a $3.5 billion bill that's boosting spending in health by $3.5 billion for a variety of causes. We're talking about all kinds of things. I'll show you. Boosts care for child care expenses, expands child care assistance, and makes it easier to qualify for that aid for families. The bill also keeps low-income children covered for health care longer without the need for their families to keep reapplying for that benefit. And one of the controversial parts of the bill, it makes undocumented immigrants eligible for Minnesota Care, the subsidized health insurance plan that now is for working low-income families.
And where we are, members, is we're on the last day of session. And it is another good day to get all Minnesota kids off to the great start that they deserve. We know that there is no better investment, there's no bigger payoff.
If you like math, take 14 hours, divide it by 60, and that gives you approximately 1 minute per page to read this bill.
Republicans were talking about an 844-page bill, which is what the health finance bill was. Another thing Republicans objected to was the change to abortion law. It removes the so-called women's right to know law, the warning doctors are supposed to read to women about possible links between abortion and breast cancer. Now, really remarkable developments here in just the last few minutes. The House just now passed the $2.6 billion bonding bill, which passed the Senate earlier. And the way that happened is when they agreed with the Republicans to do a larger bonding bill, the agreement said we're going to avoid a long, extended debate on this. So they basically read the bill, a few people talked, and then zip, it was done. So now we're down to just a few bills that are also in the optional list, including keeping nurses at the bedside and a constitutional amendment and a bill that would send more money to nursing homes. Back to you.
All right, John, thank you.